Colibacillosis. Colibacillosis, Escherichia coli infection. Definition: avian colibacillosis is an infectious disease of birds in which Escherichia coli is the primary or secondary pathogen. Infection include air saculitis, cellulitis, omphalitis, peritonitis, salpingitis, synovitis, septicemia, cholegranuloma. Economic importance of the colibacillosis. Colibacillosis caused elevated morbidity and mortality, leading to economic losses in the poultry farm, especially around the peak of egg production, reduced feed conversion ratio, and the carcass contamination at processing in broiler. When there is systemic infection, this will lead to poor feed conversion ratio and increased mortality. Skin infection will cause inflammation of the subcutaneous tissue, which will lead to increased contamination of carcass at processing level. In layer, there is sudden mortality with the absence of typical clinical signs due to the stress factor associated with egg production and systemically accompanied by a decrease in egg production and increase of poor quality eggs. In breeder, when contamination of the eggs with E. coli lead to decreased hatchability, and when there is in ovo contamination during incubation of egg, this will also lead to production of poor quality chicks with poor livability. Occurrence: colibacillosis occur in all types and age group of poultry, as well as in other birds and many kinds of mammals. Most reported outbreaks in poultry have been in chicken, turkey, and ducks. Here in poultry raised under a low standard of sanitation, poor environmental condition, and after respiratory or immunosuppressive diseases, infection is more frequently in young than mature birds. Colibacillosis is common throughout the world. Historical information: colibacillosis was first described in chicken in 1894. Since then, there have been numerous reports on colibacillosis in poultry. Considered research on the disease has been completed. Etiology: the etiological agent is Escherichia coli. The O-somatic antigen serotype most commonly associated with disease outbreak are O1, O2, O35, O36, and O78. The capsular antigen, key antigen, most commonly associated with virulence are K1, K80. Epidemiology: E. coli is present in the intestine of birds and mammals and is disseminated widely in feces. Birds are continuously exposed through contaminated feces, water, dust, and environment. At any time, birds resistant to disease is impaired. Pathogenic or facultative pathogenic strain may infect the bird. Sequestered E. coli in such sites as the intestine, nasal passage, air sac, reproductive tract may be a latent source of infection. Certain pathogenic serotypes may have the ability to infect the normal bird. E. coli has been isolated from eggs of normal hens. Its presence has been attributed to ovarian infection, oviduct infection, and to eggshell contamination. Followed by penetration, chicks may hatch with latent infection. However, active infection will typically only occur if some environmental stress or lesion initiates the disease process. Clinical signs and lesions: air saculitis. Respiratory signs occur and vary in severity. This pathology may be associated with poor environmental conditions such as dusty litter, poor ventilation, high ammonia level, sudden variation in the barn temperature, but also with concomitant respiratory infectious disease, virus, infectious bronchitis virus, Newcastle disease virus, laryngotracheitis virus, mycoplasma, or immunosuppressive infectious dorsal disease, chicken anemia virus disease. In these cases, E. coli is secondary pathogen and will cause the air saculitis lesions. Air sacs are normally thin, glistening, and transparent, but bacterial infection will cause the air sac to become thickened. Number of blood vessels within the air sac walls increase, and exudate will accumulate within the cavity of the air sac. and acute inflammation will be characterized by the presence of mucus oxidate, which will eventually become fibrinous. Thickened air sac and the caseous oxidate in the air sac will be present in more severe and chronic cases. There often is an accompanying adhesive pericarditis, fibrinous prehepatitis, and peritonitis. Hence, polycerositis. Air saculitis occurs chiefly in 3 to 7 weeks old broiler, probably peaking at 5 to 6 weeks. Pericarditis. Most serotypes of E. coli after asepticemia cause pericarditis. Opaqueness and thickening of the pericardial sac and edematous pericardium along with the myocarditis typically occur. Pericarditis can also be caused by other bacteria, including chlamydia species. Omphalitis and yolk sac infection. E. coli is often isolated in pure culture from organs or the yolk sacs of recently hatched birds having depression, septicemia, and variable mortality. With omphalitis, the navel is swollen and inflamed and the birds feel wet. Abnormal yolk material and peritonitis is typically seen on necropsy of birds with an E. coli infection of the yolk sac. Acute septicemia. An acute septicemic disease caused by E. coli resembles fowl typhoid and fowl cholera. Birds are in good flesh and they have full crop, suggesting acuteness of the disease. This can occur in young and mature birds. Enteritis caused by E. coli is considered rare, but pathogenic affecting E. coli have been reported. Diarrhea and dehydration are noted on clinical examination. At necropsy there is enteritis. Salmonellitis. This lesion may occur following entry of coliform bacteria from the vagina in laying hens. It's also likely to develop when the left greater abdominal air sac becomes infected by E. coli, causing a chronic salmonellitis. Polygranuloma, Hagar disease. Signs vary in this uncommon disease of chicken and turkey. Nodule granulomas occur along the intestinal tract and dysentery, and in the liver the spleen is not involved. Synovitis and osteoarthritis. Affected birds are lame or recumbent. There is swelling of one or more tendon sheaths or joints. Synovitis and osteoarthritis associated bone has osteomyelitis. Ban of salmitis and meningitis. Occasionally birds have a hyperion and or hyphema, usually in one eye, which is blind. Likewise, meningitis is a rare sequelae to E. coli septicemia. Cellulitis, infectious process. This is one of the most common causes of condemnation as slaughter in broiler chicken in the United States, some European countries, and Canada. It's recognized primarily at the post-mortem inspection, with no abnormality having been noted in live birds. Diagnosis of primary colibacillosis is based on isolation and typing of coliform into one of the serotypes recognized as pathogens. Control measures should be taken to minimize eggshell contamination of newly laid hatching eggs. Eggs should be disinfected on the farm prior to storage. It should be stored under ideal conditions. Hatchery sanitation, disinfection, and fumigation procedures should be practiced. Feed free of fecal contaminations should be fed to poultry. Treatment of water with halogens related compounds as well as conversion to nibble drinker has greatly decreased the incidence of septicemic form of colibacillosis. Treatment. Numerous antibacterial have been utilized for treatment. These have included recycling, neomycin, sulfa drugs, and others, but E. coli has developed resistance to many of these commonly used antimicrobial. Antibiotic sensitivity testing is therefore strongly suggested, as well as record keeping of treatment history by farm. Thank you.